Your cat walks right up to your face, pauses, and sniffs your breath like it's checking something. Not once as a random cat moment. Again tonight. Again tomorrow morning. Again when you talk, yawn, or lie down. Your cat might ignore everyone else in the room, then suddenly lean in and study your mouth like the answer is hiding there. Most people laugh it off. They assume it's curiosity, hunger, or a weird little habit. Sometimes it is. But breath is one of the fastest ways your body gives off chemical changes, and cats live in a world ruled by smell. So when your cat keeps coming back to your breath, there are a few health problems that can sit behind it, and one of them can turn serious fast. In this video, you're getting the full list. Your cat is not diagnosing you, that matters, but your cat may absolutely be noticing you. A 2025 PLOS-1 study found that cats spent significantly longer sniffing unfamiliar human odor than their owner's odor, showing how sharply they can sort human scent. A 2023 scientific report study also found cats respond differently to human emotional odors, which tells you their noses are picking up much more than stale air and toothpaste. Breath is loaded with chemical clues. Food, acid, infection, blood sugar shifts, and organ problems can all change the way exhaled air smells. So if your cat keeps inspecting your mouth, there may be a reason. You're about to get 5 diseases behind that behavior, starting with the common ones and ending with number 5, the one you do not want to shrug off. Keep watching, because the pattern that looks funny on the couch can be your earliest nudge to get checked. The number 1. Periodontitis or gum disease. The mildest reason is often the most relatable. Your cat may keep sniffing your breath because bacteria in your mouth are creating strong sulfur smells, the kind people describe as sour, rotten, or stubbornly stale. Cats are built to notice tiny scent differences, and mouth odor is close, warm, and easy for them to investigate. Mayo Clinic says periodontitis can cause bad breath that won't go away, along with bleeding gums, painful chewing, receding gums, and even pus between teeth and gums. If your cat keeps leaning in when you speak or yawn, pay attention to bleeding when you brush, gums that look puffy, pain when chewing, loose teeth, or breath that seems worse lately. The action here is simple and worth doing fast. Book a dental exam and cleaning instead of masking it with gum or mouthwash. When your cat keeps returning to your breath, sometimes the problem really is living right inside your mouth. Number 2. Sinus infection or tonsil infection. If the smell isn't coming from your teeth, it may be coming from higher up. A sinus infection or an infected throat can change your breath because mucus, bacteria, and inflammation start draining into the back of your throat and mixing with the air you exhale. Your cat doesn't need to understand sinus pressure to notice that your breath suddenly smells heavier, sweeter, more sour, or just wrong. Cleveland Clinic lists bad breath as a symptom of sinusitis, and Mayo Clinic notes that sinus infection can cause bad breath when it happens alongside other symptoms. Alongside your cat's breath sniffing, watch for facial pressure, stuffed nose, headache, thick mucus, a reduced sense of smell, sore throat, swollen glands, or pain when swallowing. One clear move. If this lasts more than several days or gets worse after seeming to improve, get your nose and throat checked instead of assuming it's just a cold hanging on. Number 3. GERD or acid reflux disease. This is the one many people miss because it does not always feel dramatic. If stomach acid keeps washing back up into your throat, your breath can turn sour, bitter, or oddly metallic, especially at night or after meals. Your cat may sniff your mouth more because reflux changes both the smell of your breath and the way you breathe while lying down. Cleveland Clinic includes bad breath among GERD symptoms, and Mayo Clinic says constant heartburn, a symptom of GERD, can lead to bad breath. Watch yourself for a burning chest, a sour taste in your mouth, throat clearing, hoarseness, coughing at night, trouble swallowing, or the feeling of food coming back up. Your step is not just to pop random mints. Keep a note of when it happens, avoid late heavy meals, and make a medical appointment if it's frequent. Up to this point, the causes are frustrating, but they're often manageable. The next 2 are the reason a cat that suddenly audits your breath deserves your full attention. Number 4. Diabetes or diabetic ketoacidosis. This is where breath can become a real warning sign. When blood sugar is badly out of control, especially in diabetic ketoacidosis, your body starts burning fat for fuel and produces ketones. Those ketones can make your breath smell fruity, sweet, or like nail polish remover. A cat can notice that change long before you would ever describe it that way. Mayo Clinic lists fruity-scented breath as a symptom of diabetic ketoacidosis, along with thirst, vomiting, belly pain, shortness of breath, weakness, and confusion. There's also a real cat case behind this idea. In Houston, Michael Opiella's family said their cat Patches repeatedly reacted when his blood sugar dropped, and pediatric endocrinologist Dr. Michael Yaffe said animals' advanced olfactory systems can plausibly sense hormonal changes in the human body. If your cat keeps pushing into your face and your breath smells off to other people too, watch for extreme thirst, peeing more, sudden fatigue, nausea, shaky spells, or confusion. One clear action: check your blood sugar if you can, and if fruity breath comes with vomiting, deep breathing, or confusion, get emergency care immediately. Number 5. Liver failure. Number 5 is the one that can sound unbelievable until you learn what it does to breath. In advanced liver failure, waste products your body should be clearing can build up and come out in the air you exhale. Cleveland Clinic describes Fetor hepaticus, a breath odor linked to liver failure, as musty and sweet with compounds that can smell garlicky, rotten egg-like, or strangely chemical. To you, that smell may be hard to place. To your cat, it is a giant flashing sign. If your cat has started studying your breath with unusual focus and you also feel off, watch for yellowing of the eyes or skin, dark urine, pale stool, itchy skin, easy bruising, upper right belly pain, swelling, confusion, or exhaustion that feels different from normal tiredness. The action here is urgent, not casual. Do not wait to see if the smell passes. If bad breath has changed sharply and those symptoms are showing up, seek medical care fast. Michael Opiella is a teenager in Houston living with type 1 diabetes when his cat Patches starts doing something the family can't ignore. She gets fixated when his blood sugar drops. One day she's on his dad's car, meowing and trying to get near him. He already feels faint and flushed. He goes inside, checks himself, and finds that something is wrong. After he gets his blood sugar back up, the behavior stops. Then it happens again. And again. What makes that story hit is not just that a cat acted strangely. It's that the strange behavior had a pattern, and the pattern lined up with his body being in trouble. Dr. Michael Yaffe, a pediatric endocrinologist in Houston, I was convinced enough by the case to present it professionally. That is the part to remember. Your cat may not know the name of the disease. Your cat may still know your breath has changed for a reason. Oh, here's the fast recap. Breath sniffing can line up with gum disease, a sinus or tonsil infection, GERD, diabetes with dangerous ketone buildup, or even liver failure. Your cat might only be curious, your cat might just like your face. But if the behavior is new, repeated, and strangely focused, especially with a breath change, other people notice too, don't explain it away too fast. Check your mouth, check your symptoms, get checked if the pattern keeps showing up. What has your cat done when your breath smelled different, and did you ever find out why? Put that in the comments. It's because your story may be the one that makes somebody else stop postponing care. If you know someone whose cat suddenly became obsessed with their face or mouth, send this to them like a small act of protection. The next video breaks down the body area cats fixate on when the problem is not in your breath at all. Your cat may notice what you still can't smell.